Hello there. My name is Vicki Byard and I'm the Dentistry Technician Specialist at Rao Animal Hospital. We value our relationship with you and want you to fully understand everything that goes into your pet's dental procedure. We have put together some quick videos to familiarize you with the process. In the body of this email, there are two links. One, a video about the procedure itself, and a second, a link to an article on pain management. We would love for you to review them. In this video, I will be walking you through our estimate so that you can completely understand it. Now, there are no prices shown on this video because we're hoping to use this video for years to come. So please refer to the attached estimate prepared especially for you. So, on this estimate, for Calvin, you'll notice that there are line items. And the first line item you see says hospitalization surgical fee including exam. This is the cost involved in maintaining a clean cage, laundry for those nice warm blankets and towels that we provide for your pet, sanitary and clean water bowls and litter pans, dog walking and comfort care for your pet. And a veterinarian will do a brief physical exam before we give any anesthetic drugs. They'll be listening for any new heart murmurs. They'll be palpating the entire body. And they will do a temperature, heart rate, and respiration rate, and they'll get a current weight. This ensures greater patient safety. The next thing you'll see is a line item that says pre-anesthetic ECG. Even though your doctor already listened to your pet's heart the day that they recommended the dentistry, an electrocardiogram shows us that though it sounded perfect then, it's also beating perfectly now. As long as your pet will allow us to do this, this provides important information to the anesthetic team before we do anything. The next line item says anesthetic and pain management planning. We review your pet's procedure well in advance of your ever arriving. We review lab work results, patient temperament, previous anesthetic drug selections, staffing, and equipment. All this pre-work better ensures a smooth experience for you and your pet. Anesthesia. What is reflected here on an estimate is 1 hour of general anesthesia. That includes the pre-op drugs and an hour of gas anesthesia. If your pet was under anesthesia for 2 hours, your bill will reflect 2 units of 1 hour of general anesthesia. Anesthetic monitoring. You'll notice that there are 2 levels listed here. The first reflects an ASA score of 1 to 2. ASA stands for American Society of Anesthetists. This score classifies anesthetic risk. ASA 1 and 2 reflect a normal patient to one with mild systemic disease. ASA 3 to 5 reflects patients with varying degrees of more serious systemic disease. This monitoring fee is more costly because the anesthetist may have to employ extra drugs, fluids, and more intensive care. Rao Animal Hospital not only provides state-of-the-art anesthetic equipment, but also dedicates a technician solely to monitoring the vitals of your pet every 5 minutes until it's fully recovered. The next line item, dental operatory and patient warming. Despite the fact that there is no fee for this, we outlined it here so that you would understand that we take extra measures to keep your pet warm as it is under anesthesia and in recovery. Next line item, dental grade 2 routine. This is the fee associated with cleaning your pet's teeth. Next line item, complete oral exam and charting. Again, we have no fee associated with this line item, but we want you to understand that every dental procedure gets a comprehensive oral exam of all oral tissues, and we measure all periodontal pocket depths and make a dental chart of all abnormalities. Next, radiology. On this line item, there is a range. On the low end, there are 6 x-rays. That is the fee for a full mouth x-ray series on a cat, despite the fact that we usually have to take 10 x-rays. The high end is 8. That is what we charge for a full series on a dog, again despite the fact that we usually take 18 x-rays. Next line item, telephone consultation. There is no fee for this, but we hope you value the fact that we want to take the time to talk to you once we have all of the information about your pet's mouth. We want you to be in control of what care is provided, and we want you to be in control of the money you spend. Once all x-rays are done and the cleaning and assessment is complete, we amend the estimate and call you with the information, education, and recommendations. During that call, we will decide together what is best for not only your pet, but your family. Nail trim. We know how challenging those nails can be. Remember, we all have pets too. So we're happy to trim those nails while your pet is under anesthesia or recovering. Discharge appointment. Although you will have already spoken with a dental technician or a doctor about the care provided, we devote time with a technician to go over the home care required and to give you an opportunity to ask any new questions you may have. I hope this video has helped you understand not only the care that we will provide, but also what each of these line items mean. Please feel free, if you have any other questions, don't hesitate to call Vicki Byard at 215-884-0453.